Is anemia and iron deficiency not similar?
In the couple of centuries back, they identified measurement of hemoglobin, which gave a marker of how to assess the amount of blood.
So, what kind of tests one has to get done in order to understand if the mother is having iron deficiency?
If the hemoglobin is adequate, and they do a peripheral smear, by the size of the RBC, a good pathologist can make adequate iron.
నమస్తే డాక్టర్ గారు.
నమస్తే అండి, హౌ ఆర్ యూ?
ఐఎమ్ వెరీ వెల్ డాక్టర్ గారు. మీరు ఎలా ఉన్నారు?
ఐఎమ్ ఫైన్ అండి.
డాక్టర్ గారు, ఈవేళ నేను ఒక ఇంపార్టెంట్ టాపిక్, ఎవరు ఎక్కువ మాట్లాడిన టాపిక్ కానీ చాలా కామన్ టాపిక్, ఎనీమియా ఇన్ ఫెర్టిలిటీ, ఇన్ ప్రెగ్నెన్సీ అండ్ ఇన్ విమెన్, దీని గురించి మాట్లాడాలనుకుంటున్నాను. ఈ మధ్య నేను ఒక పేపర్ చూస్తే, మీరు షేర్ చేసిన పేపరే, అందులో ఎనీమియా కంటే ముందే ఐరన్ డెఫిషియన్సీ వచ్చేస్తుంది అని ఉంది. సో ఈజ్ ఎనీమియా అండ్ ఐరన్ డెఫిషియన్సీ నాట్ సిమిలర్?
Certain things they look very simple and very easy to understand, and we take them for granted. But the fascinating thing is, in the last 50 years, or maybe last many centuries, the hemoglobin or the lack of blood killed many women. Then in that context, in the couple of centuries back, they identified measurement of hemoglobin, which gave a marker of how to assess the amount of blood. As time went by, the normal values have come in. Then they realized the normal values for pregnant women and non-pregnant women are different, and a pregnant woman should have adequate iron. So many countries around the world, in their national health programs or in their food fortification programs, they added folic acid in the food and iron supplementation. In fact, in India, one of the largest program for reducing the anemia, where iron tablets of high quality, I repeat the word high quality, which undergo a lot of tests, and good quality of, because there are many iron salts. Not all iron salts get absorbed easily. Government of India made effort to select a good quality product so that adequate iron is absorbed. But the story is more than that. We can divide iron disturbances into two things: anemia of pregnancy, where the whole concept is, if she bleeds, because one great obstetrician said, obstetrics is a bloody business, because while you deliver, you are soaked in blood, or your hands are drenched in blood. When you do a vaginal delivery also, when the placenta comes, your hands are soaked in blood. It's not a sarcastic thing. The amount of blood that is lost, where our hands look as if they are washed in blood. People see it only in movies, but seldom this aspect is discussed in any public forum. The amount of blood loss, normal blood loss. Then the second thing is, except for the last decade, loss of blood and loss of hemoglobin was the leading cause for maternal mortality. So hence these programs have come in. As the longevity increases, as the understanding increases, a newer concept is evolving. These concepts have come from multiple studies, and the American Journal of Obstetrics and Gynecology, also known as AGOG, or also known as Grey Journal, which is one of the top obstetrics and gynec journals in the world, which is published in US, wrote an expert opinion saying, or it says, it gave a wake-up call to the fraternity saying, Here we are not looking at much deeper thing. We are only treating anemia, but we are not looking at replenishing the iron stores. Why so ante ఏమవుతుందంటే the baby depends for its iron metabolism on the mother while she is in the womb, and when we encourage and promote breastfeeding, the only source for iron for the baby is only to the breast milk, and if the mother has no stores, then there is less or scanty iron in the baby, which is sufficient to maintain the hemoglobin but not sufficient to do the other works of iron and the hemoglobin in building the brain. So the concept that are evolving is anemia. That means there is a deficiency of hemoglobin, and there are many causes of anemia, but the commonest iron deficiency anemia. And then iron stores should be adequate, and that is the reason iron supplementation is given to every pregnant woman, so that the apart from what is needed, the stores are built up. I am using the word the iron stores are built up,
Okay.
because she'll lose some during the parturition or delivery, and then she has to give some to the baby. And our understanding for a decade stopped at that. But epidemiologists and curious scientists from the pediatric world and the pediatric neurologists have identified if the baby had, if the mother was anemic, the baby had lesser iron and then had lesser amount of sulca in the brain. That means it also affected the cognitive functions and the growth of the brain in utero, and also after it came outside into the world, it still depended on the mother for blood because we encourage breastfeeding. So there is no way, and there the subtle milestones, not gross. That means the full potential of the slate or the baby is being camouflaged by our not understanding the deeper thought.
Doctor, so iron deficiency starts even before anemia, right?
The stores are given off to the hemoglobin to correct the anemia, and then when the stores are depleted and the demands are there, then the hemoglobin starts falling.
And you were speaking about government's efforts, so this made me remember about fortified rice. Government has strongly advocated to provide fortified rice and other grains through PDS, public distribution system. If you remember, 3-4 years ago.
But
Does that help?
the ingenuity of Indian public distribution system is the intentions of the government are noble. The intentions of the receiver are not as noble. Maybe I might be using a wrong word. They are selling it off and buying a polished rice. So we don't know whether the polished rice is fortified with these things.
Oh, yes.
Because I hear many stories from the ration shop, they sell it off for 6 rupees. So that can be one of the reasons for the failure of the government programs.
So does this help, Dr. Garu, if
Yes.
people take fortified?
Iron supplementation in any PHC, they are continuously, the ANMs are monitored that they call on the pregnant woman, give her the tablets, and I think it spends a huge amount of money. We don't realize it because it's not visible.
Yes. Doctor, you were mentioning about cognitive dysfunction in case if there is iron deficiency in the mother during pregnancy.
And also that was not corrected, and she breastfed the baby and the baby did not have any additional source of iron. That means the baby does not have iron stores, because iron is used for hemoglobin function, but there are many other roles of iron.
So, checking for the iron quantity during pregnancy should start from the first trimester itself.
And if they like, there are two schools of thought. Look, whether there is anemia is one thing. The second thing is it depends on the economic condition and the accessibility of the investigations and accessibility of reliable investigations. And there, by checking the stores, it makes a huge difference in the child development. That means small steps make a huge difference, which we think it is destiny. If a child is not performing well, because in this study he also wrote about autism, scholastic performance, schizophrenia. There we say destiny, but when we look at science,
There is a cause.
there somebody did not give the importance that was needed for this at the appropriate scale it desired. Spreading the message, the role of iron deficiency in the cognitive development of the child is of paramount importance.
Dr. Garu, you spoke about iron deficiency and the tests, right? So, what kind of tests one has to get done in order to understand if the mother is having iron deficiency?
Like I'll make it much more simpler. Uh, if the hemoglobin is adequate, and they do a peripheral smear, by the size of the RBC, a good pathologist can make adequate iron. Then you get a set of parameters when you get a hemoglobin, MCV, MCHC, MCHV. They reflect how much of hemoglobin content is there in the RBC and how much of possible iron is there. But seldom we don't even glance at it, or we don't even Google it out of curiosity to look at what does it mean. We are worried only about lipid profiles, but we don't look at fundamental things.